Good afternoon. I'd like to start by asking you all a question. When you think of AI and its impact on health, what are the images that come to your mind? Maybe it's something like this: AI-powered surgery, gleaming, high-tech operating theaters, procedures being done that were never thought possible before. Feel familiar? Or maybe it's something like this: AI-led precision medicine, detailed, fancy scans, tailored treatments just for you, even robots replacing doctors like me. And as an NHS doctor, I don't know whether to be terrified or relieved by that prospect. But if those are the sort of images that are floating around in your mind right now, then you're not going to be far off the mark, at least in some respects, because AI is likely to have a transformative impact on how we deliver care to patients. But as somebody who has seen health from lots of different lenses through my work in seeing patients in the clinic, but also building AI solutions, my work in global health, when I think of how technology can transform health, I think of this. This is a picture of my mum, age 20, taken in 1975. At the time, she was living in Karachi, Pakistan, expecting her first child. She was bright, curious about the world, not much older than many of you in the audience. But as her pregnancy was progressing, it became clear that something wasn't quite right. She began to lose weight. She was thirsty, tired. This was her body warning her that she was developing a condition called diabetes, which if left untreated could be harmful to her and her child. Yet she didn't know what those symptoms meant. She didn't know that she needed to seek help. And although she lived in one of the biggest cities in the country, she did not have access to the type of healthcare that would have picked this up in routine checks. And by the time her condition was diagnosed, it was too late. She was admitted to hospital, unwell, in the final stages of labor. And while she survived, sadly, her first child, a boy, did not. The reason I'm sharing this story with you today is because, to me, it illustrates how our circumstances can influence our health long before we get to a hospital or doctor's clinic. And I feel it's deeply relevant to how we think about the role of technology in improving health. Now, you may think this is a story from a different time, from a distant land. But let me show you something. Only 20% of our health outcomes are related to the medical care we receive. That's right, only 20%. That's all the treatment, the diagnostics, the operations, 20%. And the other 80%, they're due to the circumstances in which we live, our income, our work and education, the state of our housing, whether we have barriers in access to our healthcare. All that adds up to 80%. Does that surprise you? Because it certainly surprised me the first time I saw that statistic. And I wish I'd seen that as the first slide on my first day of medical school. And again, it's relevant to us right here. This is the gap in life expectancy for men between the richest and poorest parts of the country. Almost 10 years. For women, almost 20 years difference in healthy life expectancy. 20 years between the richest and poorest parts of the country. And it starts early. For children in the poorest parts of the country, they're almost 3 times as likely to have tooth decay by the time they start school versus children from more privileged backgrounds. Now, you may say, what's AI got to do with all this? Well, I think whilst clinical care is very important, if you want to maximize the potential of AI and these emerging technologies, then we must remember this other 80%. But it's important to say that technology alone is not a silver bullet. Many of the examples I just showed you are due to deep structural issues in how we set up our societies. But AI can be a tool. Technology can be an enabler. And I'd like to show you 3 examples of how that might be the case. You might be surprised to know that for over 7 million UK adults, the average reading age is below 9 years old. That has an impact in how you understand and act on your health. I see it in the clinic every day. Just look at my mum's story, not understanding that those symptoms meant she needed to seek urgent care. But what if AI could help make health information more accessible? I'm not talking just about translating information to different languages. I'm talking about the potential to translate the complexity of medical information. Imagine information personalized for you that is based on your social background, your cultural context, and your education, so it lands just perfectly for you. Imagine the good that could do. Or with large language models and big data sets, we have the opportunity to do just that. Remember when I said your work is a big determinant of your health? Well, here's an example. 50% of employees in the UK, that's 10 million people, lack access to basic health checks at work. That's things like health checks to prevent chronic disease, mental health support, vaccinations. What if AI could help enable a healthier workforce? How? Well, by targeting those preventative health checks to the groups that may need them most, or spotting signs of mental health, distress, and burnout before crisis hits. Lastly, access to healthcare. Whilst giving birth in the UK is incredibly safe, for Black women, they are almost 4 times at higher risk dying during pregnancy than other ethnicities. Now, this is due to complex systemic issues related to how we access and deliver care. But AI could be a tool to help us understand these health inequalities better by helping us recognize bias and blind spots in care delivery, by identifying at-risk groups so we can intervene earlier, by developing early warning systems that give voice to those who may otherwise be overlooked. Again, it's not a magic wand, but it could be part of the solution. These are just a few examples, and I hope they provide you with some food for thought. And remember, behind each of these statistics is a human story, just like my mum's. So how did her story turn out? Well, a few years later, she moved to the UK with my dad, and her circumstances changed for the better. All those things I mentioned earlier: income, education, housing, her access to healthcare. Here she is, my sister, a few years later, having clearly gone through some sort of glow-up because she looks completely different. But it wasn't just her appearance that had changed. She understood her condition better. She knew when to seek help. She had better access to healthcare. And although she is no longer with us, she lived a full life, having 4 kids, 3 grandchildren. She even used to teach me a thing or two about what it's like living with diabetes as I was going through medical school. And this is one of my favorite pictures of her, taken with my son a few years ago. So, we are in a super exciting time when it comes to health. Many of you sitting in this audience are going to help shape that future. If you take one message from this talk, it's this: that the promise of AI is not just confined to doctors' clinics and operating theatres. It is much broader than that. And it requires us to understand the human perspective and these lives. And most importantly, in remembering that other 80%. Thank you.